Okay, so normally when you buy like a refrigerator, you measure the space, right?
Hmm.
You check the price tag, you look at the hard numbers. It is entirely rational,
Yeah, completely objective.
right? But when you hit retirement and you have to pick a healthcare plan, that measuring tape becomes, well, completely useless. You are suddenly just shopping blind.
Oh, totally blind.
So today, we are diving into our July 28, 2026 exploration into the source material. We want to figure out why picking a Medicare plan causes so much anxiety, and more importantly, how you can actually navigate it without, losing your mind.
Which is so common, honestly.
It is. People are making massive health decisions based on like neighborhood rumors instead of actual facts. Okay, let's
Okay.
unpack this because people are just paralyzed. They don't know who to trust.
Well, the anxiety really stems from how we naturally try to gather information when we are confused.
Right, we panic.
Exactly. Think about how many people avoid a certain Medicare Advantage plan just because, like, a guy they know, let's call him Bob up the street, said it was terrible.
Oh yeah, there is always a Bob.
Always a Bob. But if you actually press them on why Bob said that, they usually have absolutely no idea.
Taking health advice from Bob is literally like taking driving directions from someone who doesn't even know what car you were driving,
Yep.
let alone where you're actually trying to go. But wait, if Bob and everyone's neighbors are so incredibly vocal about avoiding these plans, I mean, I would assume nobody is actually enrolling in them, right?
You would think so, yeah. But what's fascinating here is the numbers tell a completely different story.
Oh, really?
Yeah, out of the 62 million people on Medicare,
Wow, 62 million.
right, a massive group. Out of all of them, 54% actually have those exact Medicare Advantage plans.
Wait, really? More than half?
More than half, and another 23% use Medicare supplements, and then the rest are on specialized federal options, like TRICARE for Life or other federal programs.
That is wild. The absolute majority of people are doing the exact thing Bob says to avoid. Clearly, the neighborhood hearsay is just completely detached from reality. So if you are standing there, trying to tune out all this noise, how do you actually figure out what you need? Because the sheer volume of jargon alone is enough to make anyone freeze up.
It is, yeah. That is where you really have to stop trying to DIY it and bring in a certified guide.
Okay, like a professional.
Right. Someone who actually understands the mechanics of the system, someone with a certification, because really everything boils down to just three options.
Only three. It feels like there are hundreds.
I know, but it really is just three paths. First, you have straight Medicare, which is just your basic government coverage.
Okay, straight Medicare. Got it.
Then you have Medicare with a supplement, which is also called Medigap. And that acts like a financial shield for the 20% that basic Medicare won't cover.
Makes sense.
And finally, you have Medicare Advantage, where private companies bundle everything into one comprehensive plan.
Okay, so basic government, government plus a shield, or the private bundle. So what does this all mean? Like, how do you actually sit down and pick one of those three paths? How does a guide look at you and say, path 2 is better than path 3 for your specific life?
It all comes down to four specific puzzle pieces. They have to look at your medications, your current doctors, your finances.
Which is huge.
Right? Weighing the cost of a supplement versus an Advantage plan. And the fourth piece is your current health conditions.
So they really dig into your personal details.
Oh, they don't just ask about them casually. For example, a guide scrutinizes your exact medication list because Medicare Advantage plans have these strict, constantly changing drug formularies.
Oh, wow.
Yeah, so if your daily pill is not on their approved list, you are paying completely out of pocket.
Wait, seriously? So picking a plan just because it has like a low monthly premium could totally bankrupt you at the pharmacy if you don't check the fine print first.
That is exactly the trap, and you can't make a decision without completely understanding that.
Right.
And the same logic applies to your doctors, too. A guide needs to know who you see. Because if you go with Medigap, you can generally see almost any doctor in the country who accepts Medicare.
That sounds pretty flexible.
It is. But if you choose an Advantage plan, you are tied to a specific local network.
Ah, okay.
So if your longtime cardiologist isn't in that network, you are basically out of luck.
Okay, it is all starting to make sense now. It is basically a giant math equation, balancing the cost of a Medigap supplement against the network restrictions of an Advantage plan, all based on the specific needs of your body.
Exactly.
So when you are sitting down to figure this out for yourself, the biggest takeaway here is to completely block out the neighborhood hearsay.
Block out Bob.
Yes, ignore Bob. Do not base a massive life decision on what works for someone else. Bring in a certified professional who will actually map your daily pills, your required doctors, and your bank account to one of those three distinct paths.
If we connect this to the bigger picture,
Mhm.
treating your health choices like objective data, understanding your personalized health metrics, that is really the only way to turn all that confusion into a confident decision.
Absolutely. Taking the emotion and the rumors totally out of it. But, there's one glaring variable here that we haven't touched on at all.
Oh, what's that?
Well, this entire system relies on matching a rigid plan to your health status and your finances today. But human health is completely unpredictable.
Yeah, that's very true.
So if you lock into one of these paths based on how you feel right now, what happens when your health status abruptly changes tomorrow?